Good morning, world. Good morning, OPNS family. Welcome to another fabulous Friday. Listen, I had to put on the red to just make it, just to let you know just how fabulous it is today. So thank you again for chiming in, for coming in the room on this fabulous Friday. And hey, we've started branding this day with none other than Mr. Eugene Poole. Hi, good morning, Mr. Poole. How are you?
Good morning, Chantra. Good to see you.
Yes,
Praise God.
fabulous Friday, fabulous
Yep.
Friday. For just a reminder for some of you, Mr. Poole is with Aligned Benefits Group, um, which specializes for I want to say 40 years now, dealing with your insurance needs, your insurance education, those aha moments, those things that you just did not know that you needed to know. And now that you do know, you go, oh God, why didn't I study to show myself approved before? This is our third Fabulous Friday with Mr. Poole, and I promise you, I have not regretted one segment, and I'm looking forward to all that God has in store for us. So, as it says here on the message that I sent to you, group, tag, share, invite. It's time for us to learn how to get to our best place, our safe place, when it comes down to our medical coverage, our health coverage, and just the things that we need to know to protect us in all of those areas. So, once again, welcome to Fabulous Friday, Mr. Poole. How has your week treated you this week?
It's been very good. Very, very busy. Lots of
Busy is a
calls,
good
lots
thing.
of things going on.
Well, it's open enrollment too, right? So that has a
Yes,
lot to do with it. Yeah. So
absolutely.
listen, so busy is a good thing. That's the way
Yes,
I look at it. Good morning.
yes.
Good morning, Sharice. Thank you for joining us. Listen, grab your pen and your piece of paper because this man is going to educate you and blow your socks off like he's done me. So where are we going to start, Mr. Poole, today? What do you have for us? What are we going to talk about first
Okay,
today?
so we want to start with open enrollment that's going on right now.
Right.
Now, the most important thing about open enrollment is that it goes from November 1 to December 15th. But in some states like New York and Pennsylvania, they go to January 15th. So we only have really, for most parts of the country, about a 45-day window, and you know, basically 14, 15 days have already passed. So now you're down to like 30 days. Now the reason why you don't want to wait is because when you do the open enrollment program, there are certain things you have to have ready at your fingertips. That is your tax return. You got to know what your income is. You got to have your driver's license. You got to have things that if you lost coverage, you got to have a letter from the employer saying when you lost coverage. You got to know when the last day was. So what happens is that people think that they come in, they sit down, and just one day everything is done. Well, everything could be done if you come prepared for your interview. If you're an immigrant, you have a green card. We need to see the green card. We need to look at the alien number, the date you came into the country. You see, because what happens is that the reason why the date you come into the country is important is because if you haven't been here for at least 5 years, you would not be eligible for Medicaid should you be eligible for Medicaid. Also, if you're seeking your citizenship, you know, you may not necessarily want to do Medicaid because that's considered a public charge, and that could affect you getting your citizenship. So, see, there's
Why?
lots of issues
Why could
because
that?
because the current administration felt that people who come to the United States and on the public charge, which is Medicaid, they don't want to. They didn't want to issue a citizenship. That was one of the changes in the administration. So that was one of the reasons. That's why a lot of people won't get Medicaid today if they have a green card and they've been, even though they've been here 5 years, even though they may qualify for Medicaid, they won't get the Medicaid because they know it could affect them getting their U.S. citizenship. So you see, there are a lot of issues why you don't want to wait to the last minute. Because and on top of that, we still have sometimes computer glitches, things that go wrong, things have to get fixed. So if you come in the last day or the last time and thinking that everything's going to be done at that time, it'll be really, it's like early voting. I mean, you got to do it early. So, because we've only got this like 30 days left. That's why it's critically important because we don't know your situation. And a lot of times they think that we can just wave a magic wand and get the answers right quick. We can't, especially if you come unprepared. So most open enrollment people have a whole checklist of things that you have to have. You got to know a copy of did you file your taxes? Do you have a copy of your taxes? If you're self-employed, they need copies of maybe your last tax return or your payroll or your pay stubs. These are the things, and we have to see a whole month of income. So there's a process that we go through in order to validate who you are, validating the income, validating a variety of things, so that when we plug these things into the computer systems, the computer will give us a definitive answer. And the other thing that it does is that sometimes you'll get an eligibility and say, well, we'll give you the eligibility now, but they give you so many days to get the rest of the documentation together. So this is why these things are so important that you be early. Don't come in the last minute, because you'll have a challenging experience should you do it very late. We still on the air?
Mr. Poole.
Yes.
Okay, I do apologize, you guys. You said computer glitch and everything glitched on my end. So I had to come. I was like, wait a minute, computer glitch. Okay, I do apologize.
Prime example of what I'm talking about. Prime example. Best
Oh
laid
wow,
plan.
that's amazing. Okay, so the last thing I heard was computer glitch, but I'm pretty sure everybody definitely, because you guys were still live. I do apologize for that. Hey, welcome to the reality of the world today.
Yeah.
So go ahead, Mr. Eugene. I do apologize for that, viewers. Go ahead.
No, so what I was saying is that there are computer glitches. There are things that they have to make fixes in the system. Sometimes the system gets overwhelmed. Too many people applying at the same time. When the Affordable Care Act started in the beginning, there were so many people applying, the computer systems all crashed, and it went down pretty bad, pretty hard. So this is why you don't want to say, well, I got until the 15th of December to get this in. But a lot of people are late filers like that. And what happens is that we can't help you at that point. If you miss the deadline, it's over. So that's why at this time of year, you cannot procrastinate. You can't say, wait till I get this done. Let me go take my trip. Let me go do this. No. You got to get it done now.
Gotcha.
That's why it's critically important you get it done now, because we get to a point where our hands are tied. There's nothing we can do at that point.
So when we're talking about open enrollment, this is the time to definitely reach out to Mr. Eugene Poole. We'll make sure that we put his information in the caption here a little bit later. But this is one of those times for you to reach out to Mr. Poole or people of like to be able to get some unanswered questions answered, to be able to, get the guidance to navigate you through. Because I mean, it is what it is. You don't want to be like you said earlier, you're getting ready to have a surgery, and that surgery is successful. Everybody is great. Surgery is over, and then you got a $50,000 bill to pop up that says Merry Christmas, and you don't understand, wait a minute, how do we get here? No, I have insurance. No, I paid that, and so let's talk about that. What do you do in that event, Mr. Poole? It seems like everything is going well. You feel like, hey, you signed up with the insurances that you desire to have. You're covered in every area, or are you?
Well, that's an excellent question. So before I answer that question, let me just make one statement about this in general. Medical care in the United States, this is one of the few products and services that you buy where you go in and you don't know the prices.
Okay.
You have no idea. And the medical community does not necessarily have an idea, because they don't know if they go do surgery what they're going to find.
Gotcha.
So it's kind of a jack in the box kind of thing. It's a surprise all the way around. Surprise to them, surprise to you, surprise to everybody, surprise to the insurance company, surprise. So anyway, trick or treat kind of thing. So
Gotcha.
so anyway, so you have the surgery, and everyone is very happy, elated. The surgery went well, and then a couple of days later, you get a bill for $50,000. Now your joy gets tempered with that because all of a sudden you fall to the floor. You don't know what to do about that. So here's what happens. The first thing is that sometimes you'll get a bill from the provider of service, but that bill is letting you know basically what they're going to be billing your insurance company. Now,
Okay.
so the first thing you do when you get a bill like that is you first read it. First and foremost, read it.
Reading is fundamental.
Yes,
Yes.
read it to see what they're saying, and don't react to it just yet, and don't go rushing down trying to pay it yet. And the reason why you don't do that is because if you have insurance, you must wait for the insurance company to send you something called an EOB, stands for explanation of benefit.
Wait a minute. Wait a minute. I think you just told the people and me,
Mhm.
okay, you got that bill in the mail, and that bill is saying, hey, you owe $50,000.
Right,
So before I move to make arrangements to pay these $50,000,
right.
I need to do what now?
You need to wait for to receive in the mail an explanation of benefits from the insurance company.
Wow.
Now, the reason
How
why you
many people
need
knew
that,
that?
huh?
How many people knew that? I mean, you don't really think about that to get the explanation. You just think, okay, I know I had the procedure.
Right,
This is what they say that I owe. So
right,
let me go ahead and move my monies around and move my bills around. But you're basically saying, don't move until
right,
you have an explanation of the detailed drop of everything that you've charged. Okay.
right.
Okay.
Well, I mean, and what I'm sharing with you this morning, it happened to my own family. Okay, I'm telling you what actually happened to me. With a loved one. So we got the bill for $50,000. But me being
Okay.
in the industry, I knew, okay, that's fine. But let me see what the insurance company say about this bill.
That's fine.
So
Okay.
I get the explanation of benefits of the $50,000, and the insurance company says, "Well, we disallowed $12,000 right off the bat because that's just not what we agreed to pay." So
Okay.
that brought me down to 38,000. Now I happen to have two insurances, so not only did I have to wait for an explanation of benefits from my first insurance company, but I had to wait for the explanation of benefits from my second
For
insurance
the
company
second.
too.
Okay.
So
Okay.
all the things that the first insurance company didn't pay, the second insurance company did pay. All right, and
Okay.
and they also discounted it even further. So a $50,000 bill got discounted down to about $25,000,
Oh,
and
oh.
yeah, and then they said patient responsibility zero. I didn't have to
See, this is
pay.
why you my friend. This is why you my friend. It's things like that because anybody that can help a sister save
Yeah.
$25,000,
Yes.
we are friends until the end. Okay.
Yeah. Yeah. So I have to
Wow.
see if I wasn't in the industry, being a senior, we like to pay our bills and all that stuff.
That's
So
right.
we tend to run to overdo it. Oh, let me get this paid right away. Well, first of all, we don't have
Right.
$50,000. So most people don't. Okay. And even if you did, it is not a good practice to go out and pay the bill at face value as a
Yeah,
general
that's
rule of
not what you
thumb.
want to spend it on. Right.
Yeah, because what happens, people get the bill. This is what I say that medical procedures that we get done is one of the few things you do where you really don't know what the costs are. It's one of the
Okay.
few things that we receive. You don't know, you don't even know if 50,000 is reasonable.
Right.
You
You
have no
just know that
clue.
that's what they said.
And because you can't take that $50,000 bill and go to hospital B and say, can you tell me what you would have charged me? It's not. There's no comparison shopping.
Right.
You see,
Right.
it's not like buying tomato ketchup at one store versus another store. I
Gotcha.
bought a 16-ounce bottle of tomato ketchup for this price at this store, and it was cheaper over here. That's what we're used to doing. But
Right.
medical care doesn't allow us to do that.
Right.
We do it in
Right.
terms of the insurance company's premiums that we pay, whether or not we can afford it in our budget. But we don't do it for the actual receipt of services because how many times have you gone into a doctor's office or a hospital and they have the prices posted right on the wall so you can see all the prices?
Not the nail shop.
Yeah,
No.
yeah, you don't see it, right?
Right.
So,
Right.
so what happens is that we are in a society where we are really dependent upon the insurers to tell us because they have all the accounting systems. They even know how much deductible you paid during the year. They figure all that out for you. They keep track of all that. So even if your bookkeeping is a mess, their bookkeeping is very, very good. Okay, they know. They'll say, Mr. Poole, you've met $2,000 of your $5,000 deductible this year. You still owe $3,000. They will tell you that in the explanation of benefits. So you don't know if you have two insurance companies. Make sure that you wait for both explanation of benefits to come, because what happens is that one company is primary, another company is secondary. So they wait for the
Right.
primary company to pay. Like for example, if you have like Medicare and say Blue Cross is secondary. Medicare might pay first, and then they'll tell Blue Cross what they paid and say, Blue Cross, here's your part, and Blue Cross will tell you, oh, this is the part we're going to pay, and oh, by the way, we disallowed all these extraneous charges because they were just not approved, and therefore your response is only zero. That's
Mm.
exactly what happened to me. That's exactly what happened. But as I said before, the hospital will send us a bill very quickly. And most people get a bill like that with panic. But
Mm.
you gotta be cool, calm, and collective, and you know that the insurance company is going to send you an extra. And it's usually like a letter that you get from them that most people don't even open and read. They see the word insurance, throw that away. That's the explanation of benefits that you need.
Gotcha. Gotcha. One moment. There's technical difficulties. One moment.
Okay.
Oh, wow.
Okay. Don't hear you yet.
Can you hear me?
Yes, I hear you now.
Don't ask me how you have two of me on the screen. I have no idea. This is really crazy.
Goblin.
Okay, can you hear me now?
Yes.
This is interesting on this Fabulous Friday.
Yes.
Okay, so basically, what you're saying is with the Fabulous Friday, our nugget today is reading the bill to wait on the explanation of the bill before you commit
Right.
to $50,000. Now, one of the things that you said earlier was that because you got the explanation of the bill, because you waited instead of making the payments. Because, okay, let's just keep it real. The older we are, the more we understand that paying our bills and paying them on time helps our credit.
Right.
So nobody wants to gamble with it damaging their credit.
Right.
So we just try to hurry up and pay it.
Right. That's the problem.
Okay, go ahead.
Yeah. So what happens is that this is one of the few things you get a bill. It's not like your mortgage or the utility bill.
Mhm.
We have so many days. They're giving you basically a statement saying, "Hey, this is what we did for you," and all that. And then on top of that, when I waited for the explanation of benefits to tell me, and usually it comes in like an envelope that very few people pay attention to.
Okay.
They will lay it out. They'll say they charge all these procedures, but some of these procedures we disallowed. But you don't know that. You don't even know why it was disallowed. And
Okay.
the amount that they charge, they may say the amount is disallowed because the provider of service is a participating provider of, say, Medicare or participating provider of Blue Cross, which means that they have already agreed to set the usual, customary, reasonable payment for this procedure. So all those excess charges, they have agreed to not follow up with that.
So if you're okay, I just want to make sure I understand what you're saying. So I'm having this extensive surgery.
Mm-hmm.
There are several different parts, several different hands that need to uh, prepare, do this surgery.
Mm-hmm.
So what you're saying is that it's possible for one entity, one contractor, to not be approved
Mm-hmm.
by my insurance company after the fact.
Well, here's what I mean. Let's say that you want to have your appendix taken out, just as an example. They may, and then say they bill you $3,000 for that, take out the appendix. If the provider of service is a participating provider of your insurance company, they said, well, we're only going to pay 1,200, not 3,000. So that means that $1,800 is not approved. is only approved for $1,200 and not $3,000. So that $1,800 is not your responsibility because the provider of service is a participating provider where they have agreed to allow the insurance company to determine what is reasonable for a given procedure.
So not my responsibility, meaning not mine, the individual, or not mine, my insurance company.
It is not your responsibility either.
Okay.
If they're participating with that insurance company, this is what we call the hold harmless agreement. Okay? So what happens is that if I want to get $3,000 to take out your appendix and my insurance company says reasonable customer is only $1,200, the other $1,800 is off the map. It doesn't. Nobody pays it.
And if you don't know this, to challenge this, then it's almost like we're literally giving away money.
Yeah, and so this is why I was saying in previous weeks that when a provider of service signs up with an insurer, that and what they're doing is they're agreeing contractually
Mm-hmm.
to what the insurance company is saying would be reasonable and customary.
Okay.
Because in the explanation of benefits, they'll say $1,800 was disallowed because your provider is a participating provider with us.
Gotcha.
See, this is the
Gotcha.
kind of detail I'm talking about that people
Gotcha.
are not really paying
Gotcha.
attention to. When they say that they are participating, it means that they have already entered an agreement with the insurance company. Remember, the insurance company, what they do is they negotiate these huge discounts pretty much up front.
Right.
Okay.
Right.
And what the provider of service is agreed to is that because I went with insurance company A, the insurance company A is providing me with so many patients. And because I'm getting so many patients, I say, wow, I got enough patients. I don't have to charge that because it's not, I only have one. I don't have one
Right.
patient. I got 30 patients.
Right.
So I can
Right.
afford to discount it.
Okay. So just so this compared to not having insurance. And
Right.
what I mean by that, okay, so there's all these rules and clauses and hidden things that we don't know, and until
Right.
we meet someone like yourself to educate us on that. But then let's go on the other side of this fence. Someone that doesn't have health insurance
Right.
and there was an emergency surgery. Well, we know that, typically the hospitals can't refuse to save your life,
Right.
right? Okay, which means now this $50,000 has a completely different
Different meaning.
identity. You know what I'm saying? It's
Right.
like, okay, so the 50 when I was insured, there were clauses, there was areas, for me to how do you say, get the detailed explanation from my insurer,
Right.
which after the explanation, my 50,000 goes down to 25,000 or less.
Right.
As opposed to me not having insurance,
Right.
needing the surgery,
Right.
having the $50,000 bill, and nothing to negotiate. So now
Right.
I have to pay that bill.
Now, let's talk about that. You don't have insurance. Okay. Well, see, first of all, before you have anybody treat you, as much as you can, an emergency is different. If you don't have insurance, the best thing to say to them is, I don't have insurance. Because here's what happens. They know that instead of giving you all the bells and whistles, they're going to do the bare minimum
The
they need
bare
to do
minimum.
to save your life. Nobody's going to say that out loud, but it's kind of like they're going to do what's necessary to save your life. They're going to give you the things that you need because there's a standard of care they have to give. It's called standard of quality of care that they have to give to everybody. Okay? But they're not going to go full blown with all the other stuff that they don't have to. Now, when you don't have insurance and you walk in and there's time enough to say that, then what they're going to do, they're going to give you your financial counselor, especially like in an institution, and they're going to sit down with you and they're going to try to get you signed up for Medicaid or something. They're going to try to make pre-arrangements prior to you incurring all the debt and them incurring all the expenses. That's the first thing they'll say. Well, Mr. So-and-so, sit down here with this. I need you to sit down with the financial counseling people, and they will automatically try to find a way to get you covered. And even if they can't get you covered there, they may have the surgery done maybe at a freestanding surgery center, which would be a lot less expensive than to do it in a hospital. They try to find ways to get this down so that you don't be overwhelmed with a bill or a debt that you can't pay.
Right.
They try
Okay.
to they try to help you get insured,
Okay.
okay, as much as
Okay.
they can, which is different from you walking in, signing the paper, knowing that you don't have any insurance and you don't say a word. That's where they really, really get hot.
You know, when you explain it like that, I sort of feel bad for getting an attitude with people that was asking me all those questions. Because
Yeah,
I'm like, wait a minute, what is this? Lady, I got a cough, I got a fever, I want to go home. Why are you trying to? And basically, the way you just explained it, it's like, no, they're not there just to be nosy.
right.
They're there to find out what your unique situation is so they can assist you further. See how you just helped me? Okay, that's
Yeah.
great. I
So
won't
what
be mean
happens is
anymore.
they're trying to find a way to get you qualified for one of the state programs,
Okay.
because even if you don't have coverage, and there's certain things they do for emergencies. Okay, so they have an allotment for emergency, so to speak, where they
Okay.
will do things, but you
Okay.
but you have to let them know up front that this is where I am.
Okay.
Right
Okay.
now, so getting back to the financial counsels and all, so they're trying to find every possible way to find money for you before you're treated. They're trying to find every possible way to get you into a program before you're treated.
Okay.
That's why they ask all those nosy questions.
Okay.
Well, if your income is this, then you qualify for Y.
Right.
You see,
Right.
if you're a family of two and you have this, that, and the other, it's okay. Basically, we have a program. We have a thing at the county clinic we can get you into. You see,
Wow.
so that
Okay.
way they can help you to get there. Now,
That's
but
good. That's
like
good
I
to
said,
know.
if you have just an emergency, okay, and you still have the $50,000 bill, what you have to do, you got to sit down, and it's best to talk to people that know what they're doing,
Okay.
because see, you can't imagine a $50,000 bill being whittled down to $10,000,
Right.
but it goes on every day, every single day of the week. But you don't see, consumers are not skilled at that, you know,
Mm.
as to what the real bill is, because you don't know what the real value is. All you know is that you got better, or you did get better,
Right.
and you're trying to figure out how to pay for all
Okay. So that's good. That's good because that really just shed a whole other light on that because it used to aggravate me.
of
And
it.
I would see people if I'm sitting in the waiting room and I would see people, so sick that they can barely. And you're asking all of these questions, leave people alone. But I understand because I mean, at the end of the day, monies have to move somewhere, and we're
Somewhere.
trying to figure out what the best fit is for you. So I get that. I get that. So let me ask you this. Let's say we have someone with a pre-existing condition, right?
Hmm.
That is needing health coverage.
Hmm.
A lot of people won't apply because they feel like because of their pre-existing condition, their health coverage is going to be through the roof. Now
Right.
we know that in the media here lately, dealing with government officials, we've been seeing it one way. One day it'll say, they're getting ready to pass a bill that refuses coverage for someone with a pre-existing condition and so forth and so on. I've seen so many different explanations of this. How does this work? If I have a pre-existing condition, obviously I need health coverage, right?
Right.
how how can I get coverage? Can I get coverage, and is it astronomically high?
Okay. First of all, one of the best things the Affordable Care Act did was they got rid of pre-existing conditions where the insurance company could not charge you a higher price because of it.
Okay. Okay.
Okay, and they also could not deny you coverage because you have pre-existing conditions.
Okay.
So this open enrollment, all of those things are in effect.
Okay, now say that again because I want to share that with the people in the caption here.
During this open enrollment period, where you have an opportunity to get coverage, all of the Affordable Care Act clauses are in effect.
Okay.
No pre-existing conditions, physicals are covered, pap smears, screenings are covered.
So everything is covered.
Everything is covered. Okay.
Okay.
Now, not everything, but everything within reason.
Well, and when I say everything, I'm saying those pre-existing conditions.
Right,
If I
right,
have,
right,
like, I have asthma, or I
right.
have a skip in my heart, or I have diabetes, or I have blood pressure issues. Those are the type of pre-existing conditions.
Right,
And
and
you're basically saying,
they don't take that into consideration. They don't even ask the question.
okay, okay,
We can't even ask you those questions anyway. So
okay,
what happens is that's the beauty of the Affordable Care Act, is that they got rid of all those things. Okay, so here we have this 30 days left now. People still think they got time, like the time to go shopping or something. But the thing about it is that you, know, you got to get it in now,
get it in now, get it
because
in.
right now the law favors you. Okay, it protects you. So that you can't. In fact, because you have diabetes, you don't even pay more because you have diabetes or heart attack or anything. They must write you as long as you pay that premium. They must write you during this open enrollment period. Okay, so this is why it's such a tragedy that I see people talking to people that don't know anything about anything. They're just angry about stuff.
Right.
They're just angry. And because of some previous experience they had. But right now, this is the one time during the year. This is why I say this is like a get out of jail card. Whatever problems you were having during the year where you couldn't get the coverage, now you can get the coverage. Mm-hmm.
Okay, so Mr. Poole, hmm, give you a scenario here. You've been doing this long enough. I know you're going to be able to get it right off the top of your head.
Mm-hmm.
So, 35 years old, single mother,
Mm-hmm.
part-time job, uh, and I have three kids,
Mm-hmm.
but I'm working.
Mm-hmm.
So there's no need for me to go through open enrollment because I know that they're going to give me a very high monthly insurance cost that I cannot afford. I'm not on welfare. None of
Mm-hmm.
my children have an issue or sickness to where they're receiving Medicaid. So what do I do?
You apply. If you don't have insurance, you apply. The reason why you apply is because you see you're 35 years old, say for example, and you have three kids. And what happens is that we look at the table based on your income. See, affordability is based on the percentage of your income. It's,
Mm,
it's not based on any other factors other than mathematics. They see that you're 35 years old and you make $35,000 and you live in Atlanta, Georgia. They know that, in fact, we have what we have something called federal poverty level. It comes out, it's put out by the Department of Health and Human Services every year, every January. And they show us what the federal poverty level is. And what these programs do is they use 138% of the federal poverty level to determine whether or not you get Medicaid or you get the Affordable Care Act. And the amount of help you get is based on also the number of people in your family. So if you make $35,000 a year and it's just you get so much help. But if you have $35,000 a year and three kids, you get more help.
gotcha.
You see,
Gotcha.
but you
Now
won't know what that is unless you apply.
you apply. So now you just said something. If it's you don't make $35,000 a year and it's just you, then I mean it's a no-brainer. Obviously,
You'll
your
get help.
monthly is going to be more than
Right.
it is with you being 35 years old, uh, mother with three kids.
Mm-hmm.
On that end, so it's income based, circumstance based. Would that
Right,
be
and the number
fair
of
to
people in your
say?
household. Right.
Okay, okay, that's good to know. Um, wow, that's good to know because
That's why you could have two 35-year-olds and one 35-year-old will say, "But I got this. They told me I made too much money." And the other one with three kids said, "Well, I got all of what I needed." You see, um, that's
I
why
got you.
it's sort of the blind leading the blind.
Gotcha.
Today, no one's reading or studying enough to understand how does it really work. And because the Affordable Care Act is about 3,000 pages long, um, average person's not going to read that. So, so that's one of the reasons why I got certified in the Affordable Care Act under the National Association of Health Underwriters. And check this out: of the National Association of Health Underwriters, there are approximately 100,000 members, but only 4% of us are certified in the Affordable Care Act.
Mm,
So it's about 4,000 of us in the country who are certified in the Act, which means that we've taken some exams and all that, and we have to understand how the law works and how to apply it. See. So it's the application of the law to understand how does that work. And so, that's why I say that if you don't apply, you'll never know.
So if we don't apply, we'll never know. If we don't apply, we can gamble with having all of these astronomical bills that
Yes.
we are now having to pay, which in return is going to have a direct domino effect on your entire life. Is an outstanding bill that you can't pay that goes into vault, messes up your credit. You know what I'm saying? Messes up your payment history, your payment worthiness. So it's a domino effect in not securing yourself. I want to shift the atmosphere here just for a moment because I remember I had the pleasure of interviewing an insurance company over was about a year and a half ago on my television talk show. And one of the things that we were talking about was how people run away from the insurance man.
Yes.
You know, when I was a little girl, I knew that there was this blue envelope that hung on my grandmother's wall, and that the insurance man would come around every month and he would collect the insurance and have a great day. But then there were some times where the payment wasn't there, you
Mm-hmm.
know, and so everybody better be quiet because the insurance man just pulled up in front of the house, you know, that type of mindset.
Mm-hmm.
So a lot of people are still carrying and walking that mindset in the world of someone pursuing you or trying to sell you any form of insurance, life
Yes.
insurance, health insurance, the whole nine. I want to shift the atmosphere here for people to hear. Again, I know we shared this a few weeks back, but people need to know why you have dedicated 40 something years to this industry. They need to hear, that it's not just about chasing your paper. And I know you said something last week. Listen, you're not paying me anything.
Right.
It does not cost you anything but your time
Right.
and your mental space for me
Right.
to help educate you to your best place. So, talk to us about why this is such a passion for you and for so long.
Well, I want to address two things before I give you why my passion is there. The program that you were talking about, the insurance guy used to come to your house in the African American community. When they sold life insurance, we had an agent called the debit agent,
Okay.
and the debit agent was the one which would go in these communities, especially in the African American community and other poor communities, and they would collect a premium for life insurance. These were life insurance premiums
Mm-hmm.
to keep the life insurance in effect. So
Yes.
and usually there was a time where where we could only buy up to $25,000 in history.
Yes.
Okay, so we couldn't buy 50,000. We could only buy up to 25,000. And as I said before, it was pretty much in poor minority communities where they had the debit agent. They literally walked and literally collected the money on a weekly basis because a lot
Mm-hmm.
of people didn't have checking accounts. A lot of people paid in cash, you know. So the earlier period, that was going on quite a bit. And you may still find a few debit agents today.
Okay.
But be that as it may, for the life insurance world, I'm in the health insurance side of the house. Okay.
Okay.
So let me tell you why I'm passionate about it. Once I began to understand how the insurance industry got started, health, when I say insurance, I mean health insurance.
Okay.
So let me tell you the story real quick. The story is what people will remember.
Okay.
So in Dallas, Texas, in 1929, the school teachers. In 1929, America was pretty much an agrarian society. We were pretty much farmers,
Okay.
and we were bartering. We were paying with cows and chickens and this, that, and the other, milk and tomatoes and peanuts or whatever. So the local school teachers in Dallas, Texas, asked the hospital administrator at Baylor University what they could do if they got sick and had to be admitted in the hospital, because they said that we're teachers, we don't make that much money, but if we get sick, we just don't have the kind of cash to pay the hospital.
Okay.
So the hospital administrator at Baylor University thought about it, and he said, "Listen, um, can you teachers kind of pool your money? You all in the teachers union, can you guys pool your money together? And then, if each one of your teachers would pay 50 cents a month, we don't want 5,000 teachers paying 50 cents a month. We want to get it from your union so one check comes for 50 cents a month per teacher. Okay?
Mm.
We want to,
Mm.
if you do that for us, then here's what we will do for you. If any teacher who's paying their dues, paying their 50 cents, gets sick, and you have to be admitted in the hospital 40 days, up to 40 days, you won't have to pay a dime. It'll be free.
Okay.
Okay. And so the teachers thought about it. They got together with their folks and they said, yeah, we agree to pay 50 cents a month. Each of us will pay 50 cents a month with one check.
Okay.
Right. So that program worked so well. That was the start of what we call today Blue Cross. So when you hear the term Blue Cross, it means inpatient hospital treatment. If you get admitted into the hospital as an inpatient, then that's Blue Cross. Okay, pretty much the hospital bill. And actually, it also includes some outpatient stuff in the hospital as well. Now, when the doctors who were in private practice saw what Blue Cross had done with the hospitals, because this thing was so successful, it spread like wildfire throughout the country. Everybody was saying, because what health insurance is really doing is pooling the money in advance of sickness. That's what you're doing.
Say that again.
What health insurance does, it pools money or
Okay.
collects money in advance of you being sick.
Gotcha.
Now, so as a general rule of thumb, 20% of the people will always be sick. It's just that you don't know which 20% you're in that year.
Okay.
So sort of like a round robin.
Yeah.
This year you're sick, next year you're not,
Yeah. Yeah.
So,
Yeah.
so 20% of the people actually use 80% of the premium. The 80-20 rule. That's how it works. So we're collecting this money. So if you get pregnant, you get sick, you get a cold, this, that, and whatever, and they have to admit you into the hospital bill is covered for the first 40 days. There is no additional money to pay. But if you stay in the hospital for the 41st day, that's when you have to pay out of pocket. Most people don't stay in the hospital for 40 days,
No.
They stay 3 to 5 days,
Right.
But that was the start of Blue Cross. In addition to that, what happens is that if you, let's say you stay in the hospital for 40 days and then you come out, if you go back in the hospital again for the 41st day, that means you're paying out of your pocket because you used up your 40 days. But if you stayed out of the hospital for 60 days, your 40 days gets renewed all over again in the same calendar year. All right, let me repeat this. Now follow me. If you go in the hospital for 40 days, let's say you go to the hospital for 10 days, and you come out for 2 weeks, and you go back into the hospital, that means you got 30 days left because they consider that the same confinement period. But if you stay out of the hospital for 60 days, let's say you stay in the hospital for 10 days, and you stay out for 60 days, your 40 days gets renewed all over again for that same year.
That's okay. Out of everything that we talked about, I mean, that's a good perk.
Yeah, yeah. Now, the reason why I'm telling the story because if you understand the Blue Cross Blue Shield story, okay, you will understand how Medicare and all the rest of them work.
Because I was now it's funny you said that because as you were talking, many people know that I'm a rare bone cancer survivor, and I know the Medicaid and the Medicare comparison. You know what I'm
Right,
saying? And
right,
as you were talking, that's what it made me think about.
right.
That what? Okay,
So,
okay.
so let me finish on this. So this is how this works. So if you stay out of the hospital for 60 days, it begins a new confinement. But if you go in the hospital less than 60 days after you were just let go, that's considered the same confinement, and you only got 30 days left. You see? Now, that process is the same process that Medicare uses today.
Yeah,
They
it
base it on
is.
they base it on the system back from 1929 when that was first started with Blue Cross. Now, so Blue Cross is hospitalization. Blue Shield came into existence because the doctors who were not employed by the hospital, who were self-employed, said, we'd like to find a way to get paid better. So they formed Blue Shield. That's why the term Blue Cross and Blue
Blue
Shield.
Shield.
Okay?
Oh wow.
Okay? And what the doctors decided to do is that they decided to charge their prices based on your income. the doctors were always participating with your income. In other words, it used to be that if you made $5,500 a year, the doctor could charge you full charge. Okay, but if you made less than $5,500 a year, the doctor gave you a huge discount.
That's just not right, though. I mean, I'm sick. I'm sick. I need the treatment. I need the treatment. I need the
Yeah, but
coverage.
see what it is that here's the thing: certain industries are very low paying. So what
Hmm.
the doctors did is said what they're saying is that if see that's the first affordability of Affordable Care Act.
Okay.
The doctors are saying, look, if you can afford to pay me my usual price, I'm going to charge you the usual price. If your income is above 5,500, and if your family income is above 8,000, they say, okay, we would charge you the normal price. But if your income was below, we would give you a discount because we know you can't afford it, but you need the coverage. That's exactly what they were doing.
Gotcha. Yeah.
Follow me?
Yeah.
Now, so Blue
Wow.
Cross was hospital, and Blue Shield was the doctors.
The doctor.
Now, 1939, 1940. I'm sorry, I have to tell you the story. There were people that were in the medical field who were not a hospital, they were not a doctor, but they were pharmacists. They were allied health. They were physical therapists. They were all these people. So they said, "Hey, Blue Cross Blue Shield, what are you going to do for us?" And Blue Cross Blue Shield said, "Okay, we're going to form another division called Major Medical." And when Major Medical was formed, that was the first time the term deductible came into existence. So when you have Blue Cross coverage for hospital, Blue Shield coverage for the doctor, and Major Medical coverage for everybody else, that was considered comprehensive coverage.
Because you got the whole package. You got the whole
You
shebang
bought the whole
in
package.
every area. You
Yes,
know
yes,
what? And,
right.
and this is hilarious.
All right. Now, hang on. Hang 1 second. One thing else I'm going to tell you. So, you heard of Kaiser Permanente.
Yes.
Kaiser's a hospital. Permanente are the doctors.
So, okay.
You heard Medicare Part A is for the hospital. Medicare Part B is for the doctors.
Wow.
Everybody follows that pattern, and everybody has the whole harmless agreements that I talked about earlier. They agree to certain prices in advance, certain things that they were going to do. They made these deals. So when you're walking around without insurance, thinking that you can beat the system somehow, or that you don't need to pay these premiums, you don't understand that these people have already given the volume discount
Yes.
for you.
Yeah. Yeah.
And the other thing is that Blue Cross and Blue Shield was a nonprofit organization, nonprofit, and
How?
because they started out as a nonprofit. They're not a profit-making organization. They're nonprofit. They were designed to help people get health care. That is
Wow.
part of why, yes, I'm going to answer your question. This is why I have such a passion because once I understood that they were the premier organization trying to address the terrible healthcare needs we had in this country, and we had no financing mechanism to how to pay for it. Now,
And by adding that structure,
they
it is
provided the structure. So
right.
from 1929 all the way to 1965, Lyndon Baines Johnson had a war on poverty. And this war on poverty, on Title 18 and Title 19, established Medicaid for people who had federal poverty income, and they established Medicare for people who were 65 and older. Because these are the two vulnerable groups. People who have low income, but they work every
Right.
day.
That's right.
Okay, so they came up with the Medicaid program, and then they had for people who became 65, you could be a great person all the days of your life, never miss the bills, all this kind of stuff. You get older, all of a sudden you got hospital bills beyond belief.
Yep.
That's why they established Medicare. Remember, I said in my previous program, necessity is always the mother of invention. That's why these programs were invented
Right.
to
Right.
address a tearing need in our society. But how do we help people so that they don't have to go bankrupt, so they don't have to lose their home? That's the whole idea behind it.
Hmm. Mr. Poole, I want to take a moment here as we are preparing to wind down. Let people know how they can reach you. Email, phone number. How can our viewers and listeners reach you?
Okay, so the easy way to reach me is by phone. My office number is 301 925 2050. That is 301-925-2050. And if you want to email me, you just do info, info, at Align Benefits Group. I have to spell it out for you. info at Align, ALIGNED, benefits, BENEFITS group, GROUP.com. And I will get your email or your phone call. So you
Uh,
see, so that's those are some of the reasons why I'm so passionate about it, because this need that we have in our society is always with us. It is always with us. And what I'm trying to do is find ways to help us keep our wealth by not paying too much for our health.
I like that.
You know, we want to keep our wealth if we don't go bankrupt trying to pay for our health. You see,
Yes,
so
sir.
so so that's the idea behind it. So no matter what one person thinks about insurance or this and that and the other, you have to take the time and say, well, why do I feel that way? You know, and that's how. And it was the same thing for me in my community too. I felt the same way until I went. And by the way, Align Benefits Group, GROUP. You have
Oh, that
GRUP.
is okay. I see it. I
Yeah,
see it. We'll
yeah.
correct that.
Group,
Thank you.
GROUP.com. So I'm always on this mission to try to make sure that we not only survive as a society, as a community, but we thrive. And what I saw was one of the things that was devastating us was having unlimited liability for medical care
Right.
without having some sort of bargaining chip or organization that will work to try to make sure that we have fairer prices or more reasonable prices or affordable prices, and without trying to make sure that our health insurance does not exceed our ability to afford the health insurance, which is why I like the Affordable Care Act, because it was the first time they really quantified and said, look, if these health insurance premiums are above 10% of your income, it's not affordable. You see,
Yeah.
this is a whole system that designed around answering specific questions about affordability. It also addressed the issues of pre-existing conditions. It addressed issues of fairness. But it also tried to make sure that the people that were providing the medical services are getting paid
Covered too.
what they should be getting paid as well. You see, so there's a
Mm.
whole balance here that we're trying to address. So no matter what people, I mean, healthcare is something that people are very passionate about. And but what I'm trying to do is I'm trying to be as transparent as I can to let the public know, look, these are the programs that are available for you. Now some people like to shoot the messenger, they don't want to hear it, all this kind of stuff, and I get it. But I'm just trying to help you to understand. If I can help you to understand so that you can live free, so that you won't be in debt. It's all the reason. And the other thing is that there are a lot of people who don't go to doctors and hospitals, and we're dying needlessly because we feel like we cannot afford to go. So the Affordable Care Act, the Affordable Care Act says, this is what we're going to do. For those of you who need physicals, you need screening. We know that if we can catch the disease early in the process, we could save your life, like prostate cancer,
Right. Right.
and colon cancer. If we can get someone early in life, we could save that person's life. So what they decided to do is let's not make that subject to the deductible at all. Women need mammograms. Let's not make that subject to. We don't want to make that an economic decision.
Gotcha.
We want you to
Gotcha.
be able to go and get that screening done, so you know at least where you stand and know what to do. And the sooner you know it, the better our chances of living. See, so these are all the reasons why I'm so passionate about what I'm doing, because I know that we're saving lives.
Yeah.
We're
Yeah.
saving people from going bankrupt. We're showing people the things that they can afford or not afford, what they can do. This is why this is my 40th year in this, because I'm so passionate about it. Because it's like a doctor. I don't do the surgery, but I help you from a financial perspective of how to protect yourself and get there early so you can have a long, healthy, productive life. That is the goal for anybody, and I don't care what community you live in. Everybody needs that.
I love the way you put that because just keeping it real, uh, in the African American community, we don't talk about it like this.
Hmm.
I remember saying something at an event that I hosted a few years back. Um, you know, if we want different, then we're going to have to explore different. We're going to have to entertain different. And when I say different, I'm saying it wasn't a round table conversation. The conversations were more so, I got to work because I got to pay this bill and I got to do that and I got to do that. And it was such grimness, grim light that was shined on what we needed, the necessities, as opposed to understanding, okay, this should be a automatic part of your financial stability.
Yeah.
Financial stability, not just dealing with the money that you have in the bank, but the same thing with your health coverage, the same with your car insurance, your life insurance. And it just was not, we knew that the insurance man came, but we didn't have the understanding and the concept of why. Maybe Granny did, and that's
Hmm.
why she paid it faithfully every month. But growing up, it wasn't the language that we heard. It wasn't a roundtable discussion, and I think people need to know now, in today's time. If you don't talk about it, we can't be about it. As a
Right.
mother, if I don't take and have dinner with my children and we talk about the things, because they're not going to be children long,
Right.
so having this type of conversation, and each one of these Fridays has really opened my eyes from a standpoint of understanding that, you know what, don't allow yourself to have the headache because you need to cover yourself with this.
Right.
If this is not covered in this area, are you not important to you to where you want to be covered? You
Right.
know, so this is really good. This is really really good. And my middle child has been chronically asthmatic since birth. She had her first asthma attack when she was 2 months old. Can you
Mhm.
imagine how
Yep.
out of my mind I was? Thank God, at that time we were active duty military, so we had the coverage, you know. But what if we didn't?
Right. Yeah.
What if we didn't? And I noticed a difference. Okay, here's a transparent moment for me. I noticed a difference when we went from having TRICARE,
Hmm.
the insurance, military, you good, right?
Right.
We went from having TRICARE to now mommy and daddy are divorcing.
Hmm.
There is no more TRICARE. They treat anything. I learned then the level of importance of keeping myself protected
Right.
to where I don't have to get the bottom treatment.
Yes. Yes.
If and I at first I looked at it as, I'm bringing my baby in here every time we come in here. She's in a coop tent. Every time we come in here, she said every time we come in here, it's 5 days, it's 10 days. My upbringing trained me mentally to just look at it as if the hospital was just wanting to take my money.
Right.
When in all actuality, it was giving me the treatment that was conducive and that I could afford
Right.
based on my child's condition.
That's correct. That's correct.
And so that to me was an aha moment. So now I have those discussions with my young adults,
Yes.
my children. I have, three grown children, two trying to get there. And I have that discussion with them, about keeping yourself protected. Don't gamble with the money just because you want to go and buy the finest outfit, or you want to go hang out with your friends. Let's not do all of that. Put that money where it's supposed to go, and having ourselves properly protected will save us in the long run. Thank you so much, Mr. Eugene, because I get it. I get it. And I can only pray that my young listeners, viewers, and my older listeners and viewers get it too.
Now, one other thing I do want to mention that I run into, before I forget, that we mentioned last night, for your listeners, we're not giving out legal, tax, or accounting advice. I have to always say that.
Right.
Okay, but we're just sharing with you some ideas that we found in the field that have been helpful to most people. Now, here's another philosophy that I see out there. I don't need insurance because um, I'm good. I'm healthy. Um, Only people that get sick, people not following God's will, or
That's
they
good.
have all of these statements that say, "I'm good. I'm healthy. Why should I pay the money? I'm healthy. I'm healthy as a horse. I don't need to pay." And I say you kind of missed the point of insurance. Insurance is you're transferring the risk of unlimited liability. When you don't have insurance, you have unlimited liability. You're transferring the unlimited liability to the insurance company to limit your liability. Okay,
Ah,
you see that? See, they say, why should I pay it? No, no, it's you. See, you already have the risk, you just don't know it, or you're denying the risk. You see, I can't deny the risk. I can sit here today and talk to you today and be hit by a car tomorrow, or today, or the next minute. We don't know the day nor the hour,
that's right.
right? So why would I want to put my family in financial bondage? Because my ego would not allow me to insure
You
against
are
an
preaching
unlimited
right now.
liability on behalf of my family to protect my family from this type of financial
You
burden.
are preaching right there.
You see, that's what you're doing. And so what happens is that some people, they want to go into denial because they're angry with the insurance company. I get that, but let's not let our anger overrule common sense. You know,
Yeah, and it costs us in the long run.
yeah, it costs you. I mean, would you drive a car without auto insurance? It's not
Of
a
course,
matter.
people do it all the time, but it's not
Yeah,
smart.
yeah, it's not smart because what happens? They'll say, "Oh, I'm a good driver, so I don't need to buy that insurance." That's why they have state laws to make it mandatory. You see, because they know that
Mm,
you're making a financially foolish decision. You see,
this
and
is good.
and the same thing's happening with health insurance. So the best thing about and the good news about this open season is that look, I have premiums all the way down to $1, okay, a month.
Mm,
Okay, so if people say I want to save money and all this kind of stuff, we got them programs. The Affordable Care Act gives you every possible combination you can get. You see, so I have one couple. They were paying $2,400 a month, and when we got done, they were paying $31 a month. $2,400 a month to $31 a month when I put them in the Affordable Care Act. You see, so but if you don't apply, we as a community have simply got to stop burying our heads in the sand on these issues. We have to face these issues and say, look, let's just stop talking to people that really don't know. I love my friends and everything, but let's apply. Let's go to the exchange. Let's talk to the professionals and apply. You know, and the other thing about insurance is that there's a lot of different types of insurance. Some insurance just pays for accidents only. Some insurance, we call them indemnity policies. They're not really insurance. They say we'll pay you this much money if you get hit by a car, you get embedded, you break your
hmm
leg. That's what we
hmm
call indemnity. And I sell all those types of programs, but I sell them for different reasons. There's an application for all these different things. When do you buy this over this? Sometimes you buy one program in addition to another program. You see, like for example, although I have health insurance, when I traveled to China, when I was doing my master's, my first master's, I bought international medical insurance because the insurance you buy in the United States ends at the U.S. border. It does not cover you in China. So I had to buy international medical insurance to cover me in China when I was there, and even to the point of an air evacuation if needed. You see, so there are different types of insurance. There's different levels, time periods, conditions as to when you buy something, when you do something. Every time I rent a car, I always buy the collision damage waiver, for example. Why? Because if the car is sitting on the street and someone sideswipes the car, you don't have to be doing anything wrong. The fact that you rented the car, you have total responsibility for it. And when the insurance company sue you, they sue you not only for the repair of the car, which your regular insurance will pay for the repair, but it will not pay for lost profits, for all the profits that they're losing for every day they can't rent the car.
Gotcha. Gotcha.
You see, so
Gotcha.
that's why you buy the collision damage waiver because then you're covering all losses. When that car gets sideswiped or hit, you haven't done anything wrong. You walk away. You don't have to fill out the first claim form. That's why I pay that $25 to $28 a day.
And 25 to $28 a day as opposed to the value of that car and
That's
all of the
right.
headache and all of the paperwork. Okay, Mr. Poole, I'm just going to say stop stepping on my toes. We all look for it is what it is. We all look for the bargain. We all
Yeah.
look for the cheap way out. Okay, how much do I, need to spend just to get the bare minimum? but
Mm-hmm.
not even understanding that the bare minimum can cost you the maximum.
It
You
can
know,
cost you dearly. Yes,
ah,
yes.
this is good. This has been good. Um, we are closing here. What is the last nugget? I know we talked about as a recap. Open enrollment is now, people.
Right.
Open enrollment is now. And even though you may have decided to put this topic at the bottom of your list, if it's not at the top of your list, it can actually cost you everything on your list.
Yes.
So we have to reposition this and understand that keeping ourselves protected where we can stay in our best health, will we be in the know of what's going on with us, it equips us, both mind, body, spirit, physically, everything, to be able to handle everything that's on that list.
Yes.
Open enrollment, like Mr. Poole said, you don't know until you apply. So please, guys, his number is on the screen. And if he can't help you in whatever city and state and area, oh, he'll navigate you where you need to get the help. So that's number one. We talked about with the medical bill. They can definitely, the medical bills can, maybe somebody's calling now, amen.
Mhm.
The medical bills will definitely pile up and then can have a domino effect on your credit report if you are not handling your business,
Right.
so okay, so open enrollment, you don't know if you don't apply. Having outstanding medical bills can damage your credit report, where we're all trying to get approved for everything. But most importantly, not being protected means you don't get the quality medical coverage and medical health that you want, the services that you want and need. I just, for me, don't give me half of the medicine that's already a knockoff of the main medicine that I need, all because I'm not covered. And if I'm in a position to be in control of how you treat me, then I think I want to take that control and run with it. I want to do the things that I need to do to keep me a-okay. So in closing, Mr. Poole, what is that lasting nugget for today's Fabulous Friday that you want to leave with our listeners and our viewers?
The most important thing I want you to understand is this. When you apply for coverage, some of you have coverage on your job. The purpose is not to try to tell you to drop your job coverage. That's not the purpose. The purpose is to see if what you have is adequate based on your needs and is it affordable. So I can't tell you a number of clients that I work with, and I review the job coverage, and I see that they have everything that they need. And they were complaining that they said, well, my job is making me pay so much and blah, blah, blah. And I said, well, yeah, but compared to what? Let me show you what it's like if you didn't have the job coverage, what it would be.
Mm,
And
yeah.
when they see that, they go, oh my God. So what happens is that in our business, I talk to a lot of people. Like I said before, we don't make a dime, but we're committed to making certain that you make the best possible decision. Now, one thing I do want to correct, and that is because you might get something with Medicaid, what happens is that the quality is still there. It's just that they may not do as many things
As many
as they
things,
would
right?
if you had, traditional insurance,
Right.
because they can't afford to do every little thing possible. They have to find more cost-effective ways to give you the quality, but at a lower price point.
Gotcha.
So the quality would be there. So I just want to correct that, make sure we're
Okay.
clear on that. But I would just say that please, whatever you do, pick up the phone and call an agent that's in this business. Okay, whether it's me or anybody else, you can go to healthcare.gov, and as soon as you go there, it's gonna ask you, would you like help or assistance? You know, you can get help. The help is available, but you have to go to the right website and get the people that know what they're doing, because we are not allowed to sell you something that you don't need. Okay, when they say, well, I don't want that, I don't want this. Well, we're just saying to you, look, we see that you have a gap here, and this is a liability for you, a risk for you, and you could transfer that risk to an insurance company that can take care of that risk for you. So it's not just about your emotions; it's about what it is that you need to do in life. I have many things, and I'm sure anybody who's successful will tell you there are many things that we do not because we like to do it, it's because we need to do it.
We need to do
We
it.
have to do it, you know. And because if we don't do it, we know the effect. Like getting up and exercise and all these other things. These things help us. You know,
Yes.
whether we want to do it or not. But I think that in life, as we live longer, we begin to realize that there are certain steps that we could have taken 10, 20, 30 years ago that we didn't do it that we're now regretting. You know, don't be in that position in life. Take advantage of the things that you don't understand. Ask for help if you don't understand. Talk to the right people who are in the business that understand, and give yourself an opportunity to win. All we really want you to do is to win, to be
When
healthy, wealthy, and wise.
I got to put that in the caption: healthy, wealthy, and wise.
Yes.
I love it. Thank you so very much, Mr. Poole. I look forward, obviously I'm excited when we're on live and when we are communicating, and I'm looking forward to the next because we grow best together, y'all. And healthy, wealthy, and what was it?
Wise.
Wise. That's what I thought. Um, we grow best together. And putting ourselves in a position to be taught how to live our life more effectively, how to take advantage of the things, as I learned today, that are out there to help us to our best place. So listen, all of y'all that are just as guilty as me, we're getting mad with the people, the little nice lady at the hospital that was in the window that was asking you all those questions. See, okay, after today, I know I can't get an attitude with her anymore because they're there basically to find out, and that makes sense. I can't I can't offer you what I know you need if I don't take the time to find out what you don't have. So I get it. I get it. So studying to show thyself approved, it is always me being the student when I am before you, Mr. Poole. And thank you so very much for pouring into us. And I just hope that those ringing phone lines has something to do with this broadcast because people need to be in the know. People
Yes.
need to be in the know in order to get to their best place. So once again, OPNS family, thank you so much for meeting us. Some of y'all beat me here this morning. You can find us every Friday from 8:45 to 10 o'clock for Fabulous Friday with Mr. Eugene Poole and Align Benefits Group. Thank you so very much. Have a blessed weekend. And Mr. Poole,
Mm-hmm.
I can't wait to see you again.
Thank you.
All
God
right.
bless.
God bless. Y'all have a good Friday, blessed weekend. We'll see you.